We are taking an adrenaline soaked cut Merocel to make space in the nasal cavity. We are starting with the coblenter assisted adenoidectomy. We decongest the mucosa using adrenaline soaked Merocel. Now we're inserting a feeding tube through nasal cavity and getting it through the oral cavity. As you can see, we're passing and we take this feeding tube through the oral cavity. We are passed from the left side, so we are rotating it to the right side to take the uvula along with it to lift the palate. This purpose is to lift the palate. Now we are entering the nasal cavity. We see the adenoid and we enter the coblenter through the posterior pharyngeal through the oral cavity along the posterior pharyngeal wall. You can see the end of the coblenter now. The coblenter is facing towards the camera. Always face the coblenter towards the camera, and we are starting with the coblation at 7. Now the main focus is that we will not harm the tubal tonsil. You can see the movable part is which is coming along the suction to the coblenter itself is the adenoid, and the lateral part which we are not touching is the tubal tonsil. We do not harm the tubal tonsil in this process. We take the adenoids layer by layer. Layer by layer is very important as we do not enter from posterior end. Always do anterior to posterior where we can see what we are cutting. Coblenter assisted adenoidectomy is something we do under vision. The main motive of doing this procedure, moving from the traditional cold instrument adenoidectomy, is doing under vision. We are doing under vision. Every part we are cutting from the coblenter is under vision. We are cutting layer by layer. This hardly takes 15 to 20 minutes in a coblenter assisted adenoidectomy. Do not rush the process. As we can see, there is small bleeding which will eventually stop when we remove all the adenoids. There is no using too much of coagulation. I am just coagulating, so there is the field is clear. As we remove the adenoids from till the base, the bleeding will stop itself. We are right now in the left nasal cavity and cutting the adenoid to make space in the left nasal cavity so patient can breathe in the post-operative period. You can see I'm not crossing the midline, not cutting the adenoid on the right side, just cutting the adenoid, just coagulating the adenoids on the left side only. You can see layer by layer there is minimal to no bleeding. Adenoid is a very vascular structure. Use a microdivider or a cold instrument is bleed profusely, but when you are using a coagulator there is no severe bleeding in this case. You can see there is mild bleeders. We can coagulate to keep a field clear. We are not using coagulator to stop the bleeding. As we remove the adenoids, the bleeding will stop itself. We are continuing with the coagulation, removing till the posterior pharyngeal wall. There is a concept we call, if we remove 80% of the adenoids and leave behind the 20%, we do not enter in the mucosal or the muscular surface of posterior pharyngeal wall to keep our vital structures safe. There is a vessel called carotid present in the posterior lateral part, so you don't want to harm that. Now we enter in the right nasal cavity. You can see the right nasal cavity is also pretty blocked. We are using the coagulator. See how smoothly it is removing adenoids layer by layer. Again, I'm emphasize on that. Do not harm the tubal tonsil. It will later cause the complication, eustachian tube dysfunctions and many more. So layer by layer, keep your calm. Okay, layer by layer we are removing the adenoids using the coagulator. Current setting of the coagulation is 7 and coagulation is 5. See, now I'm cutting at the superior part. The superior part bleeds the most. So when we remove the superior most part, we use coagulate in the end, so it doesn't bleed onto the remaining adenoid and obscure our field. So keeping our field clear, removing the adenoids with the coagulator. So this is surgery of patience. Okay, do not rush the surgery. Keep your adenoid probe of the coagulator or the wand of the coagulator towards you, and adenoid will come to the coagulator itself. You don't have to go towards the adenoid will come towards you. Okay, there is small bleeders always when you cut the adenoid. Using the coagulator, it's a minimal to no bleeding at all. As you can see, when we started there was no space at all for breathing. Now we have made the significant space in the left and right nasal cavity as well. Okay, we are removing. Okay, the next thing I want to focus is that some part of the adenoid, you will think the adenoid, but these are the mucosal surface, the muscular area of the posterior pharyngeal wall itself. You don't want to harm that because it will cause some bleeding in the post-operative period as well as pain in the post-operative period. So leaving behind 10 to 20% or 15% of adenoid is still fine if patient is not bleeding. In place of you are entering in the muscular surface. Okay, do not enter in the muscles of posterior pharyngeal wall. A good surgeon should know when to stop. Okay, you will find yourself in a place when you will say, I will do little more and little more, and eventually you enter into the muscular surface of posterior pharyngeal wall and you are facing a complication. Okay, there is a very minute difference between a good coagulator assisted adenoidectomy and a complicated one. The difference is when to stop. Okay, now we are checking for hemostasis. There you can see there is a small bleeder which is actively bleeding. Now we identified the bleeder and coagulated. Okay, see, just a single. We have almost cleared the adenoids. Okay, there is some part in the superior surface. We are removing that. Okay. Now I have this temptation of removing little more, and I think there is some tissue on the posterior pharyngeal wall that I am removing now. I will just shaving it off, giving it a final touch. Just shaving it off. Okay. Try not to go too laterally. Leaving behind few adenoid tissue is still okay if patient is not bleeding. Okay. If you have left behind the gross adenoids, it will bleed. But you can see the clear wash, and we are finished with the coagulator assisted adenoidectomy.